Hello and welcome to Doorway to Wellness. My name is Laura Kinley and I'll be your host as we explore today's episode on Community Wellness Centers, an idea whose time has come. Our guest today is Dr. David Kamnitzer, affectionately known to all as Dr. David. Dr. David, talk to us about the state of America healthcare today.
Sure, I'd be happy to do that. And Laura, thanks for hosting the show and thanks for being with me tonight. Well, I don't think it would be a big surprise to say to the viewers that in the United States, we are definitely not winning the healthcare game. Statistically, compared to other countries, we don't stack up very well. Just about everybody knows many people who have different kinds of cancers, cardiovascular disease, diabetes, obesity, trouble sleeping, anxiety, depression, ADD, ADHD, memory problems, fatigue, chronic pain, feeling stressed out all the time. So obviously something is not working. We've got, I think, well over 35 million Americans uninsured, many more underinsured, many more than that who would like to get competent health care but can't or don't. And so it's a huge problem. And what I thought we would do today in the beginning is kind of take a look at this problem and pick it apart a little bit so that sometimes if you understand the problem, the outlines of a solution start to reveal themselves.
That sounds good to me.
And so let's start out with what's called the current prevailing model or paradigm or way that we think about healthcare. You know, I don't know about you, but you know, we're probably in a similar generation. I know when I was a kid and I was growing up, I know that the only time my family thought about health or thought about going to a doctor or thought about healthcare was if one of us had a really high fever, or if we had a broken bone, or if we were in severe pain. In other words, when I was growing up,
Something seriously wrong.
health was basically defined not in a positive way, like radiant wellness, well-being, clarity, alacrity, aliveness, joy, inspiration, it was basically defined in a negative way. We only thought about health when there was something wrong, So that whole way of looking at health was kind of the way we were kind of thrown without even consciously being aware that we were kind of thrown that way, but we were thrown that way. And then also we were raised with the idea without even thinking about it, because we were like a fish in the water. We didn't know we were in the water. We just sort of grew up that the only interventions were either pharmaceutical drugs or a vaccine or surgery. And so I don't know about you, but when I was growing up, I didn't know about nutrition. I didn't know about herbs. I didn't know about homeopathy. I didn't know about chiropractic. I didn't know about essential oils. I didn't know about meditation. I didn't know about stress management. I didn't know about the impact of the health of the family and the health of the community on health. And so we were kind of sort of thrown to be like the way you throw a pot. We were kind of thrown to think in a certain way about health and about healthcare, but we didn't even think about the fact that we were thinking about it that way. It was like a blind spot, like a fish in the water. The fish is influenced by the water, but the fish has no frame of reference, doesn't even know it's in the water, but the water is still influencing the fish. So this is sort of the thought water that you and I have been swimming in that we didn't know we were swimming in. And it was, of course, reinforced by everything in our society, the way doctors are trained, the way doctors were paid, the way medical schools were accredited. Everything sort of conspired to have us thrown this way. And it seemed to work pretty well for a while. But what's happening now is it's not working so well, because what's happening now is that in our society, we're not like dying from acute malaria anymore. We're dying from what are called chronic degenerative diseases. We're dying from cancer. We're dying from cardiovascular disease, diabetes, liver problems, things like this. And it turns out that there really is no amount of surgery, no matter what Angelina Jolie thinks, there's really no amount of surgery, and there really is no amount of drugs that really on their own can really honestly solve these problems. Now, that would be, I mean, that is a challenge in and of itself. The fact that the healthcare delivery system can't address it, but it's made even worse because the people aren't telling the truth about that. The doctors aren't telling the truth about that, and the patients aren't willing to see the truth of that. So there's this, not only is the existing paradigm not working, but also we have an additional problem that we're not telling the truth about the fact that the whole paradigm, the whole water we're swimming in, is never going to deliver on the promise of health. There just is no amount of drugs. There is no amount of surgery that will lead to a solution to the problems we're facing. And
by being reactive instead of proactive, waiting till you have something wrong and trying to fix it.
But even if you didn't wait, like for example, let's take the Angelina Jolie example. She thinks she's being proactive by having her breast cut off.
Because there's breast cancer in her family.
Right, so she's got this way of thinking that is that I'm a victim of my genetics.
Right.
And therefore, the loving thing to do for me to be around for my kids is to have my breasts cut off.
Yeah.
But what's going to happen next? Next, she's going to cut out her ovaries and her uterus. And then what's she going to cut out after that? In other words, if you take that way of thinking and you extrapolate it, it becomes absurd. So there's something wrong with this picture. In other words, if the end-all and be-all of preventive health care is to start cutting our body apart, there's something wrong with this picture. And people know there's something wrong with this picture intuitively. They're spending hundreds of millions of dollars on this potion and that potion and this thing on Home Shopping Network and this thing that's advertised in the middle of the night. So you've got sort of this weird polarity here where you have the official party line, which is drugs and surgery. And then you have on the other hand here people trying to play doctor who really don't know that much, trying to fill the leaks of a sinking ship. And, you know, these are extremes that just aren't working. And there's kind of this general feeling of despair that comes when you don't understand a problem. And so when you don't understand a problem, you don't have a rational basis for confidence or hope that the problem can be solved. But what we're doing today on this show, where we're honestly talking about the problem, where we're looking at the whole paradigm that gives rise to the behaviors and the thoughts and the feelings and the actions of a whole society. And it turns out that if we're really going to have a quantum leap in our health care, we've got to go all the way back to this kind of a conversation where we look at the paradigm, the water we're swimming in, and we begin to open up to the possibility that this is just one way of looking at health, that maybe there are other ways. And if you're open to that possibility, that opens up a whole new world. Chinese medicine's been around for a long time, totally different paradigm. Ayurvedic medicine's been around for a long time, totally different paradigm. Homeopathy's been around for a long time, totally different paradigm. So what I wanted to do as in counterpoint to this paradigm that isn't working, I'd like to just let the studio know to go ahead in the control room just to put up the slide on the triangle model. And what I'd like to do is I'd like to introduce an alternative paradigm. Not that this is the right paradigm, but this is a different paradigm. And my experience as being a holistic doctor in private practice for over 26 years, coming from this kind of paradigm, I can say that by coming from this paradigm, there's some new possibilities that show up that are very exciting. So I'm assuming we have the model
it's
up.
there, yeah.
So this is a triangle model that I developed over many, many years of clarifying my own thinking in private practice and looking and seeing at what worked and what didn't work and refining it. And so we start out with a triangle and the 3 angles in the triangle. And if you just look at the top angle of the triangle, that is your inner world. And that's basically something that we intuitively know. And that is that when our attitude is a certain place and we're having certain kinds of emotions, like if we're feeling positively expectant and we're feeling grateful and appreciative, that these things influence our health. And we know that when we're expecting the worst and when we're obsessed with things or thinking about the past all the time or putting ourselves down, we know that affects our health. So we intuitively know that one of the things that affects our health is represented by the top angle of that triangle, which is our inner world. An easy way to see that is if you've ever been in love. You know, that's something in your inner world, but obviously it has effects on your physical body too. You know, your eyes look different, your complexion looks different, your appetite might change. So one of the things as you're looking at this triangle, when we describe the different angles, a real key idea is that one angle influences the other two. So now let's look at the bottom left angle, which is your biochemistry. And we know this has a big impact on our health. So for example, if you were sitting here and you had just had 8 martinis, that would have affected your biochemistry, and it's pretty obvious that that would have affected your inner world, how the evening would appear to you, the way you would walk, the way you would talk. So that's an obvious example that human beings are influenced by their biochemistry. And it makes sense that if you're influenced by your biochemistry when you have 8 martinis, that you might be influenced in a different way if you had a shot of wheatgrass juice. So intuitively it makes sense. And then the lower right angle of the triangle has to do with structure, the physical structure of your body, your posture, how you move your body. And I think anybody who's ever maybe broken a bone and couldn't move a body part or has had a bad back and something like that, and that affects the way they move and the way they breathe, you know after a while that's also affecting what you're thinking about and how you're feeling and what you feel like you can accomplish and your level of confidence. And it might change the way you breathe, which would affect your biochemistry, etc.
So that mind-body connection is really,
it's huge.
Needs to be part of the equation.
Oh, well, I'm suggesting this new paradigm
that
this could work better.
Okay.
And so this triangle is the foundation of the model, but then I expanded the model because what I realized after being in private practice for many years is that human beings are also social creatures, and that just like human beings are influenced by their thoughts and their biochemistry and their structure and movement, the human beings are also very, very influenced by the people that they're around. You know, one of the things that's tragic in our culture is that when people get older and they can't care for themselves, in our culture, one of the things we do that's horrible is that we isolate them. We isolate them with a bunch of other older people that are having similar problems. You know, so they get isolated and cut off from the patterns of nourishment that would occur in healthy community. And so it turns out that
intergenerational, is that what you mean? For a healthy pattern?
And also they don't go outside. They don't get sunshine anymore. They don't get fresh air. They don't get a wider variety of food. They don't get a wider variety of intellectual stimulation. They don't get touched as much. So their whole relationship to life starts to become very prescribed, and their world really shrinks down. That's an example of. So anyway, it turns out that social psychologists have discovered that we're far more influenced by cultural norms and the quality of the people that we spend time with than you would tend to think about. And so one of the things I found from being in private practice is that, especially if someone is going to go through the challenges of having to make some changes, the kind of external support system they have, what's their relationship like with their significant other? Do they have friends that really have their well-being at heart? Are they part of groups that are life supportive? You know, this turns out, so in the model, we not only have the main triangle, but we have other triangles around that triangle, and that stands for the fact that your relationship with other human beings in the culture are really important. And so if you look at this paradigm compared to the drug and surgery and radiation paradigm, you start looking at human beings in a really different way. And you start looking at the whole process of what is a healthy person in a different way, and the thoughts that start coming to you about how you would go about promoting a healthy person and a healthy community, there starts to become a lot more possibilities. And so this is how my process evolved, just wanting to be a better doctor, and in looking at my successes and looking at my failures and really analyzing my failures and looking at where the breakdowns were and then constantly trying to improve. That's how I developed that paradigm. And so when I looked out from that paradigm and I started asking the question, what would it take to really have a healthy community? Not healthy like we were thinking when we were a kid, like, well, you're healthy if you don't have a fever, but healthy, like vibrant, like alive, like functioning at a high level, like thinking about, okay, if I wanted to live in this healthy community, if I wanted to be a part of this healthy community, and I wanted to reverse engineer how something like that might happen, what kind of structures and systems would need to be in place to support that? The idea that kept coming to me over and over again is what this show is about today. The idea of the establishment of a community wellness center. So if we really look at those three words, a community wellness center, center is kind of obvious, like a location where things come together. And wellness, if we talk about wellness like the way we're talking about wellness now, not the way we would think about health when we were kids, but wellness as this positive, dynamic balance, this higher level participation in life. And then you really think about what community is. You know, community is really the relationship between the lesser whole individuals and the greater whole, the society. And it became obvious to me that if we were going to have a community wellness center that worked, that the whole community would need to really be involved.
So the opposite of a hospital then. Instead of going there because you're sick, you would go to this place because you are well and want to share it with people?
No, I wouldn't think of it in terms of opposites.
Okay.
It's more like this will empower hospitals to do. See, part of the problem is that people are expecting too much from their hospitals. They're expecting their hospitals to help make them well. But see, that's not what hospitals are designed to do. What hospitals are really designed to do is to practice short-term, critical care, acute emergency procedures, and then get you out of the hospital. But there's no amount of short care emergency procedures that will lead necessarily to high levels of wellness. It'll maybe buy you some time, but the question then comes back to you. All right, let's say you had this procedure in the hospital and you were going to die, and they did this procedure, and now you have some more time. Now the question is, what are you going to do with your time? The question is, what were you doing with your time that got you to the point where you needed to be in the hospital? Okay, so this is really not opposite anything. This is really Like one of the things that's really frustrating, if you like can get doctors to really let their hair down and talk to you know what they tell you? They tell you it's really frustrating because 80% of the people who come to me, I really can't help them that much. They'll tell you these are really conditions that are related to lifestyle, how you're eating, how you're moving your body, how you're thinking, chronic stress. And what these people need, I can only provide a small part of. And so I don't see the community wellness center as opposite anything. I really see this as empowering the hospital to stop pretending that it can be all things to all people and to let the hospital be what it's really meant to be, to tell the truth about that, and to say, hey, if you want more than what the hospital can provide, here. So that leads into the conversation of what else? What can a community wellness center provide? What might it look like? How can people access it?
So instead of the lecture that the doctor says, you need to change your diet, you need to change your lifestyle, you need to not be sedentary, you need to get exercise and all of that, it could be in a place that is like the community wellness center?
Right, because look, the doctor that's telling you that, a lot of times they're fat and they smoke. Right? So the person really doesn't even have the moral authority to tell you that. And then if they do tell you that, what kind of support do you have? What kind of guidance do you have? What kind of expertise does the doctor really have in exercise? What kind of expertise does the doctor really have in nutrition? What kind of expertise does the doctor really have in stress management? What kind of expertise does the doctor really have in teaching you how to garden or how to shop or how to relax? In other words, it's like there ain't no apples in that orange barrel. It doesn't matter how good you are, how smart you are, how sexy you are, how much money you pay. There ain't no apples in an orange barrel. And I'm saying, okay, it's okay. The hospital, the MD, doesn't have to be all things to all people. Let the hospital, let the MD do what they're really good at without having to poo-poo everything they're not good at. I don't poo-poo the MDs. I don't cut people up. I don't give them drugs, but believe me, if I broke my arm or if I had a third-degree burn, I'd really be happy to have the drugs. And I'd really be happy if I had some obstruction that was blocking an artery and I needed to have it surgically taken out. You better believe I'd be happy. But you know what? There's no amount of tumors I can have taken out of my body. There's no amount of drugs that I can take that will lead to high levels of wellness. And let's just call a spade a spade. Let's just admit it. There's no amount of surgical procedures. There's no amount of drugs. There's no amount of radiation that will lead to high-level wellness. So that begs the question, is high-level wellness possible? And if so, how do you realize it? And what kind of structure in the community would support it? And that leads to the vision of a community wellness center.
And where it could be, and what does it take for me to join? I'd love to find out about it.
Well, I think the first thing that needs to happen is what's happening right in this exact instant, is a lot of people need to be having a lot of powerful conversations about this topic. And one of my intentions in being a part of this show is that there are a lot of people that really resonate with this message but don't feel they have the expertise to talk about it like I do. So this is going to be like available like on YouTube or something, so people just have to go, hey, Mary, Sally, Bob, hey, look at this. So one thing is for a lot of people to be participating in a powerful conversation like this. And the next thing is for people to step up to the plate, raise their hand, not wait for doctors to change, not wait for the insurance companies to change, not wait for them to win the lottery, but for them to stand up right where they are and say, I don't know what I have to offer, but I believe I have something to offer, and I want to raise my hand, and I want to connect with the people that are championing this idea to find out how I can plug in. Because obviously, to anchor something like this, to substantiate something like this into the world as it is today, is going to require a lot of people being willing and able to contribute what they can. and different people will contribute what they can. And obviously, everybody knows what are the different things it takes to, it takes money, it takes a location, it takes people willing to put time into it. It takes a lot of things.
Well,
But
you mentioned the paradigm shifting from having it be one where the doctor tells you what you need to do, and then you're left to your own devices to figure out how to do it, or that you aren't taking charge of your own health care. And now there's much more interest in finding out about your own health care.
Right. So the vision I have for a community wellness center is that people would actually partner with the doctor, and that the doctor would be doing the things, I would be the doctor, I would be doing the things that I need to do, and then I would refer out to the medical doctors when it was appropriate, but that most of the work in the wellness center would be done by paraprofessionals and volunteers, because if it's really going to be a community wellness center, a good 80% of it, the services can be provided, not necessarily by the doctor, but overseen by the doctor. So this is an idea I wanted to bring out, is that the community can not only be part of the center by receiving the services, but part of the vision is training programs to train people to work under the supervision of a doctor. This will have tremendous benefits. One, it will lower costs. Number two, it'll be very empowering. Number three, there'll be volunteer communities, volunteer opportunities. We talked about seniors being sequestered. What about teenagers who are killing themselves because they don't feel like their life has meaning or they can make any difference? What about
there are many it could help.
What about the really, really, really sharp people who live in our community who
How
don't
do we
want,
find out more about this?
we're
almost out of time.
Anyway, you can see where this is all going. So I believe the control room has a something up there that has contact information for people that are turned on by this idea and want to plug into it.
They do. Thank you so much. So they give you a call at 858-204-3092. Thank you so much today for your wonderful discussion on community wellness centers. And wow, what a great